We're live, Chair.
Super. Thank you very much indeed. So, good evening, ladies and gentlemen, and welcome to the Adults Health and Social Care Scrutiny Board this Thursday, the 7th of December 2023, on this very nasty evening. So, I think you'll all be delighted that we're doing this via Zoom rather than having to traipse out in the rain and cause even more disruption. So, welcome to the guests as well and everybody. So, substitutes nominated for this meeting and apologies for absence. So, we have apologies from Councillor Ridron, and Councillor Durans is kindly substituting for Councillor Rivron. We also have apologies for Councillor Fenton Glynn. So that's it. Substitutes sorted out. Item number 2 is members interested for members to declare the interest at the relevant time. Item number 3 is admission to the public. There are no exempt items on this board tonight. So anybody on YouTube, you are most welcome to join, and hope you get something out of the meeting. So item number 4 is minutes of the Adults Health and Social Care Scrutiny meeting held on the 2nd of November 2023. I move those as a correct record. Do I have a seconder? Thank you, Councillor Bouchard. And all those in favour, please. Okay, thank you very much. Item number 5, we've received no deputations. That's an opportunity for members of the public to put a question stroke comment on this agenda. So we've tried to be open and transparent. And we go on to the main item of business. So we should be finished by 6:30 in my view, but possibly not. So we've got the annual Health Watch Report 2022 to 23. Karen, you're always most welcome to our scrutiny committees. You know how it works. So we've seen the reports, a very comprehensive report. If you would like to add anything to that before we open it up to members.
Can you enable me to share, because I've got a presentation I can run through for you?
I can't, but I'm sure Tom says no. Tom Mark is around. Mark Moore will hopefully be able to share that information.
Yes, Chair, Karen should be able to share now.
Perfect. Looks like I can. Let me just go to slideshow.
No pressure.
There we go. Can you all see that?
We can indeed, yes.
Perfect. Okay, my name's Karen Huntley. I am the Director of Health Watch Calderdale. I'm here to speak to you tonight about our annual report and the work that we did in the year 22 to 23. For those who don't know, there's a local health watch in every local authority area. Just move our slides on. There we go. Health Watch is the local health and social care champion. We engage with the public around health and social care matters, and we provide the public with information and signposting. We have the power to make sure the NHS and social care leaders listen to the public's feedback and improve the standards of care. And our vision is a world where we can all get the health and care that we need. Our mission is to make sure that people's experiences help to make health and care better. We pride ourselves on caring, listening and hearing. We are responsive and approachable, creative and innovative, and we challenge those in health and care leadership positions to improve and design better services, and we contribute to making change happen. Now, in terms of our staff, we have 1.97 full-time equivalent staff members, and that includes a director, that's me, 2 engagement and information officers, an administration officer, a volunteer officer, a data officer, and a comms officer. And we have 15 volunteers who kindly give up their own time to help us understand local people's views and to provide advice and help improve services. So in terms of our impact in Calderdale over the last year, we've done projects to understand the experiences of health and social care for people with disabilities. We've done some work on the impact of cost of living on people's health, and we've done some work with Overgate Hospice to capture the views of the public, patients and their carers and health professionals. We've participated in a number of steering groups, boards and task and finish groups around health and social care. And we've continued to voice public concerns about NHS dentistry. So in terms of working locally, you can see there a list of the some of the groups that we've been engaged with over the last year. I'll bring you now to what we call Project Never Heard. So in autumn 2022, we had a look at our data to decide upon our next piece of work, and we're confident that we were feeding data on themes that came up, such as GP access and dentistry, into the system in various ways. And some of that was local and some of that was regional. But what was apparent was that there were a number of people that we heard either very little from or not at all. And so we decided to focus our next piece of work on some of these people. And so Project Never Heard came into being. And our first focus was on disabled people. And this year we've continued to work focusing on men and women's health. So the engagement for the Never Heard took place face-to-face and online, using a number of methods that you can see on this slide. Some methods were more conventional than others, as you can see, and some were more creative. We split the findings from this project into children and adults. So in terms of children, young people and their families and carers, a number of themes emerged. People talked to us about GPs, notably about access to appointments and the lack of reasonable adjustments for disabled people. Many suggested that these issues could be due to staff members' limited knowledge about disabilities and long-term conditions. People talked about a need for greater compassion from NHS and social care staff. People felt they received a lack of personalised NHS care, and there were shortfalls in terms of the continuity of their care. Some people talked about schooling and said they had to let their child fail, as they said, in mainstream schooling before being provided with appropriate education. Some people talked about absences and the difficulties around absences when you have a child with a disability or a long-term condition. And others told us that they'd taken their children out of school because they felt they could better meet their needs by home educating their children. The final thing that people told us about was waiting times. So long waiting times for assessment for ADHD and autism, and also for CAMS. So this is what one of the parents said to us. I need extra time as I have speech difficulties and ADHD. Sometimes I'm not in the zone to talk right then. It can take time to trust. Doing everything in a 15-minute time frame doesn't work for people who process differently. Someone else said, I would like longer appointment times. I want to understand my needs myself, but I need longer to think it all through and to ask questions. In terms of the adults raise issues around access to all services rather than simply GP services, and concerns about the quality of care. People stated that they felt reception staff could be a barrier to their care. There were frustrations with breakdowns in communication between health professionals and patients, and a disconnect between health services. So a fragmented health service where one department doesn't speak to the other, and services and organisations don't communicate with one another. People said they needed more or better quality support. Many people and carers felt they had to push to get the help they needed, and the lack of preventative support was frustrating. People felt there was a poor staff attitude around disability, compounded by feelings that the appointments and interactions for disabled people felt rushed and unsuitable. People talked about problems accessing mental health support, especially long-term support versus crisis support. And once people received mental health support, many people felt that staff lacked compassion. Adults also reported an issue with the clarity of information. They said they want information to be clearer and more concise. So one parent said, my son was forced to speak to the doctor over the phone, even though it's a major distress trigger for him, and the doctor was aware of this. In response to the current economic climate, we also undertook a different piece of work. Now, this was a scoping exercise with regard to the cost of living, and we asked volunteers, their contacts, groups and individuals in Calderdale the following question. Tell us your thoughts on the effects on your health of the increased cost of living. And this is what people told us. They said they'd experienced increased stress and anxiety, mental ill health around the cost of living, increased debt, exacerbation of their health issues due to some people not being able to afford to put the heating on in their homes. People talked about isolation due to not being able to afford to go out and socialise and participate in group hobbies, group activities. Some people reported changing in their food buying behaviour and consumption. People said it was difficult to travel to and from health appointments and to pay for parking and prescriptions. And those with disabilities reported additional costs. So for taxis, unpaid leave for medical appointment, need for additional washing and bathing, certain foods that were necessary for prescribed diets, and those with developmental conditions where they had habits that involved an increase in heating. So, or some people with neurodiversity didn't like to wear too many clothes, so they needed to heat their house. Other people reported that they were struggling with the cost of power equipment for medical purposes. So there were quite a lot of difficulties reported by people with disabilities. In terms of our other work, we continue to work with Calderdale and Huddersfield NHS Foundation Trust, specifically the Elective Care Transformation Board. And in the last year, we've done work with them regarding barriers to remote consultations, reasonable adjustments for people with disabilities, and what's called patient-initiated follow-up. So that's where you've got somebody who's got a long-term condition who, instead of having a routine appointment, can liaise with the department concerned and can set up an appointment as they require it. In terms of our regional work, we continue to hear a lot from members of the public regarding access to dentistry. We regularly support people with dental inquiries and frequently update our website in this regard. We've recently provided insight to the West Yorkshire Health and Care Partnership, Health Watch England, local MPs and Scrutiny about dentistry. And we're currently working with the West Yorkshire Health and Care Partnership to look at innovative solutions for dentistry. Now, I've put links to 2 videos in this slide pack, which I will send to the Scrutiny board. I could not embed it into the presentation, so you can look at the links later. We've also been working with Local Health Watch across West Yorkshire on a collaborative piece of work. Now, that's been commissioned by the West Yorkshire Health and Care Partnership, and it's a people panel called the West Yorkshire Voice. That started in March 2022, and the panel is comprised of members of the public, community groups, local panels, networks and organisation, and it aims to ensure that people's voices are at the heart of decisions in West Yorkshire. The panel asks members about their experiences of health and care services, and it also allows people to feed up issues that they think are important that the West Yorkshire Health and Care Partnership needs to know about. Across all our work, we've worked hard in 2022-23 to make our communications more accessible by completing the accessible information training with the NHS, presenting our work in a number of different formats. So sometimes it's audio, sometimes it's captioned video, easy read and screen reader friendly. We've used eye-catching and meaningful visuals to engage and connect with our audiences. And we've made use of Health Watch England's new brand guidelines to ensure that documents are formatted to accessibility standards. We've adapted our approach to surveys by asking shorter sets of questions at any one time and using online polls as well. And we target how we engage with different groups. So we use different methods for different groups to ensure that we reach lots of different people with our work. that brings me to the end of our roundup. What I did was I pulled out the most relevant things to Calderdale from our annual report.
Thank you, Karen. Thank you for the excellent presentation. I think it gives a real good insight as to what you've actually been working with, and some really great opportunities. I think so yeah, excellent work. It's really important organisation for people to hear their views. So thank you for the presentation and the report as well. Councillor Kingston, followed by Councillor Hutchinson, followed by Councillor Duran. So Councillor Kingston, please.
Just celebrating that I was faster with my finger there than Councillor Hutchinson. Big win for me. So I wanted to ask about the dentistry. I mean, it's clear that dentistry is a huge issue. It's particularly affected, I'm sure, by the cost of living crisis for many families in Calderdale, because dentistry costs money, or at least accessible dentistry costs money. A lot more money than NHS dentistry. It's a significant issue. I wondered, what are you getting back from the providers? What direction are we heading in? Is there any light at the end of this tunnel that we're in? Because it's pretty grim. I bet it's got worse through the cost of living crisis, and there will be lots of people who are in dire need of dental care that aren't able to access it at the moment.
So what I would say is dentistry is very tricky. We hear lots from members of the public struggling to access dentistry, and it's almost impossible to find an NHS dentist if you're not already on the list. On the 1st of April of this year, the West Yorkshire ICB took over responsibility for dentistry, as you probably know. So we've worked extensively with West Yorkshire. So we've done an engagement session with their board. We've provided a presentation on dentistry, given extensive feedback, and we're now working with them to try and find some innovative solutions for dentistry. But I can't promise that there'll be any magic wand very soon. It's a very difficult position with dentistry.
I did actually attend a meeting a few weeks ago, and I can't remember what it was. It was to do with dentistry, though, and to highlight, the various issues. I'm hoping Councillor Hutchinson was at the same meeting. Oh, good, thank goodness. I thought I was imagining it. So you might be able to help me and enlighten the members on that matter, Councillor Hutchinson. So if you'd like to come in, and that'd be superb.
Yeah, it was the West Yorkshire Joint Health Overview and Scrutiny Committee.
It was indeed. Thank you.
And the Integrated Care Board reported how there was a considerable amount of underspend in the budget on dentistry that was still available to use for purchasing additional sort of spot purchasing of additional care, particularly for those areas that were least well served. But they weren't able to provide us with the outcome or performance data to show how successful or unsuccessful those measures had been.
Super. Thank you for that, Councillor Hutchinson. And I think it brought us onto a wider subject matter of discussing fluoridation in the water system. So yeah, thanks for that. So hopefully, Councillor Kingston gave you a better idea that we are on with this subject matter on my many hats of many serving many joint scrutiny panels. Karen, do you want to come back on that matter?
Yeah, and we are working with West Yorkshire, looking at that underspend to see if we can find innovative ways to spend it, and different solutions to the issue that we've got at the moment.
Super, thanks, Karen. So, Councillor Hutchinson, your question now.
Yeah, thanks. Having read through the report that was circulated with the documents for this minute, Karen, which was a combined Calderdale and Kirklees report, it was quite difficult to actually work out which bits were referring to Calderdale, which bits were referring to Kirklees. For example, there was a comment about about a year wait for assessment for specialised wheelchairs and a further 6 months for delivery for people with postural postural problems. Now, I know we commissioned a new wheelchair provision service 3 years or so ago. Does this delay refer to that service that residents of Calderdale are receiving, or does it refer to a situation in Kirklees?
So, can you hear me? Yes, you can.
Yeah.
I can double check where that comment came from. In terms of wheelchair services, what I can tell you is that we were heavily involved in that work several years ago. And since then, we have heard some feedback that there are still issues with the service, but not to the degree that we heard 3 years ago.
Right.
But
Okay.
I will take on board your comment about the difficulty of understanding which comment is from which area, and we'll make improvements on that next year.
Thanks. It was in one of the things, click on here and see more, that
Yeah.
was embedded very professionally and within the report. And I noticed a lot of the Health Watch documents, particularly the one about Health Watch Kirklees and Calderdale, was a very glossy presentation, which I'm sure didn't come cheap, and was going on about branding and fundraising, more than the actual service to the local population, in the way that I interpreted it, which I hope isn't the case. There was also talking about pink lanyards and ID cards for unpaid carers, which the report said have been rolled out by Kirklees Council and Huddersfield Royal Infirmary, but there was no mention of these being rolled out in Calderdale Royal Hospital or Calderdale Council. These are to identify the unpaid carers who might be accompanying somebody with disabilities to assist them in their interaction with the clinicians or other service providers, so that they understand why this additional person is there. And so, are those being used in Calderdale?
So at the moment, some of those, because of the nature of the hospital trust that is Calderdale and Kirklees, some of those have drifted into Calderdale. Now, at the moment, that scheme has not been rolled out in Calderdale. We have provided all the information to the Calderdale Carers Strategy Group, and we've offered to support that, but as yet they haven't been rolled out. In terms of your comments on the branding, our branding guidance comes from Health Watch England, and we have a comms worker who helps us put all our information together. And the comms worker is a shared cost across Calderdale and Kirklees.
Right. It was more the video that you could access on the link towards the end of the report that seemed to jar a bit, as far as in my humble opinion. Can I also ask about West Yorkshire Voice?
Yep.
And that seems to be informing the Integrated Care Board, but how is it possible to see what concerns they're raising, to see whether those need to be fed into the work of the West Yorkshire Joint Health Overview and Scrutiny Committee? Because obviously, if service users are raising concerns through West Yorkshire Voice, maybe we should be paying attention to that in scrutinising the work of the Integrated Care Board.
So we can certainly link that up with the Joint Scrutiny Panel. The West Yorkshire Voice is a panel which contains networks and organisations, so it would be very sensible to link that up there.
Please do. That would be really, really welcome. If I may, Chair, just one further thing. Towards the end of the report, it says that 6 reports have been published by Health Watch Calderdale and Kirklees over the last year, or the year in question, but there were no links given to those reports, and I couldn't find any that were specific to Calderdale on the Health Watch Calderdale website, apart from this particular year's report that we've just been looking at. How can you tell me how you get those reports?
Yeah, so they are on the website. The website is not ideal at the moment. We're looking at changing that in the way that it's a specific format, and so we can only upload things in a certain way. I can certainly send links to all the reports to Scrutiny so you can access them.
Thank you
That's
very
not a
much.
problem.
Thank you very much, Karen.
Thank you. I think thank you, Councillor Hutchinson. I think the wheelchair one we'll put on the work programme. We've not. It is a good idea to visit it, to see what progress has been made since last time. And it's quite some time since we had the service provider come in. So it would be actually quite useful. Even if it is Kirklees where the issues are, it would still be useful to get an overview. Councillor Durans, please.
Councillor Hutchinson and Councillor Kingston took a few of my questions there, but I would like to just put out a declaration of interest that I'm on the Family Voice Steering Group. So some of the work that kind of coincides, particularly with the carers lanyards, is something that we've been working on as a group. And I'll just mention that I think it would be timely that it's carried out across and not putting the responsibility on the carers, because there are carers within Calderdale that can request a lanyard. It's not necessarily always the situation when you're in crisis that you need to be kind of coexisting the staff to understand what that means and what it's about. So thank you for raising that, Councillor Hutchinson. The other question was around dentistry, so Councillor Kingston's covered that. But I do have another point, particularly about the parents' comment on the young person who was triggered around using a telephone. Both my children are neurodiverse, and neither of them are able to use a telephone independently. And we've been really lucky within our services that the health services that we've had to engage with are really understanding and proactive. So I just wondered how much we are rolling out an understanding, particularly around communication needs and neurodiversity within our health services, and whether that is a choice for our services to buy into, or there is an expectation around that accessibility, reasonable adjustments and understanding. Again, so that challenge isn't always given at the time when somebody's unwell. I hope that makes sense, Karen.
Yeah, I think there is work to be done around reasonable adjustments, around understanding that, certain people may have preferences in terms of communication. We've heard instances where someone with neurodiversity has wanted to access a mental health service, but and has specifically said in advance that they can't use a phone to communicate, but then have been given a telephone assessment. So I think there is work to do around understanding disability, and especially around reasonable adjustments, because actually people don't know that that's what they can ask for, and actually why should they have to know that? And so we often end up supporting someone to ask for reasonable adjustments. So, for example, that they can access a GP service. And sometimes, generally it's quite small things that people want, but these small things make a massive difference.
Excellent. So you mean responsibility on the service to ensure that reasonable adjustment is in place and not requested by the service user?
Yes.
Oh, thank you.
And also for staff to be more aware around reasonable adjustments, and what kind of adjustments people might ask for, so that they're just more familiar with it generally. In terms of the carers lanyard work, the issue around that, I suspect, is funding. All the information that we used for Kirklees has been provided to Calderdale, and we've been quite heavily involved in carer strategy group meetings. So we've had quite a lot of input there, but actually there needs to be some funding from the system to pay for those lanyards.
Thank you. Thank you, Karen, and thank you, Councillor Durans, for raising that. Councillor Hutchinson, please.
Can I just go back to the Never Heard project, Karen? It does say that there's been engagement listening to the Asian community, but there's no further comment on that within the report. Has that actually taken place, and has it actually produced any kind of thoughts? I mean, for the disabled groups, it seemed that the comments that they were making were those that you could expect from any member of the public, quite honestly, that about waiting times, about being listened to as an individual person, and about continuity of care. Those all seem to be very, very common themes that almost any user of the health service nowadays would actually raise. But I did wonder, you know, it mentioned that you were engaging with the Asian community, but then nothing else after that.
So in terms of continuity of care, I think that's specifically important to the disabled community because of the nature of their health issues. So I think it's very important to mention that. In terms of our engagement with the Asian community, we did engage with members of a local mosque, and we've got links to a pharmacist in the Asian community. What we do with all our data is we pull it from the service and pull it from the engagement, and then we look at it in terms of ethnicity and other factors to see if there's anything significant. And if there's nothing significant mentioned, that's because there was nothing significant from that community.
Thank you.
Thank you, Karen. Councillor Barnes.
Thank you, Chair. I have been listening, and the 20 to 5 bus that arrived at 20 to 6 has got me home at some time.
Yes.
I did have a bet whether I'd be getting home before the actual meeting finished. So thank you for asking those long questions, Councillor Hutchinson.
I'm good. I'm not that good.
I want to go back to the dentistry issue. And a couple of things, and something that Karen said, a couple of things that Karen said. And whilst I think it's good that the responsibility has come closer to home, before it was obviously very, you know, in terms of which allows us more chance to scrutiny. Just a couple of things, and I might be unfair in asking you these questions. If you don't know the answers, please, we can route them elsewhere. One, if the underspend is not spent, do we lose it? And secondly, when we started to do some work on dentistry in the past and got completely and utterly stonewalled by NHS England, and I mean stonewalled, completely dead, they were concentrating purely on treatments with no flexibility on prevention. And we were trying to get them to use some of the underspend on actually some preventative work and work within the community. Mike might remember this, and potentially, I notice he's arrived at the same time as me. That is purely coincidental, folks, purely coincidental. But we were trying to ask them to try what, you know, rather than just concentrate on treatment, could they get people into local communities, local schools to do preventative work? Are these part of the discussions that you're having?
So I'll take the first point first in terms of the underspend. If it's not spent, we can no longer access it, so it will be spent. There is some flexibility in terms of the underspend, and as I understand it, there is focus on prevention as well.
And on top of that, Karen, I think public health do quite a lot in relation to preventative and schools and etc. One of the things that we raised actually was one of the essential items in a food bank parcel is potentially a toothbrush and a toothpaste, because actually people don't see it as essential, but it really is something that, you know, for consideration. So when you are donating, I should consider, you know, those items for donation as well at the same time. Karen, thank you very much for attending this evening and taking those questions. You know, you're always welcome to attend our meetings, and we very much appreciate the reports and the presentation. I think it gives us an excellent oversight as to the current situation. Some good, some not so good, some needs improvement clearly in different areas, and as a board, we very much welcome, and we'll grab them and run with us. So thank you once again. I'm sure you're most welcome to stay, but I'm sure you may have other things and other duties to take care of. So thank you, Karen, for attending this evening and answering those questions as well.
Thank you very much. I'll send the presentation through and the other bits of information that I've promised as well.
Superb. So probably the one item to pick up from that is just to put wheelchairs onto the agenda to report as to where we are and the progress on relation to that. So thank you for that. So we now go on to the annual safeguarding adult.
Chair,
Yes,
before we do, would it be possible that when we meet the ICB that we actually flag up those dentistry questions just to see exactly where they are? And it's, I know it's not a point for necessarily for a specific agenda item, but when we meet them, I wonder whether Mike or Ben could just put that down as some questions to ask.
Yeah, absolutely, Councillor Barnes, and equal will be picking up on our other hats in our other role in another board, in another place, another time, and all that sort of stuff. And I'm sure we have so many different joint health scrutinies that it's just like you lose track of which ones you've actually been to and which ones you're actually involved in. But yes, it was a very much highlighted and very much one of the outcomes of the meeting that we had about dentistry was to actually write to the government and get them to amend their policy. You know, because actually it needs drastically amending on that one. Right, I will go on to item number 7 now. So we see adults safeguarding adults board report, and I very much welcome Marianne and Julie. So thank you very much for the report. But just before you do, it's just to really highlight that I did send an email out a few days, must have been yesterday. It seems like a long time ago. That actually Councillor Barnes and myself will be meeting with Kath to discuss the transformation programme next week. And it may well be that actually we actually call a scrutiny board meeting, an extra additional meeting in January to go through some of those key points. So just for members to reflect, and equally to reflect. Actually, the other day we had a meeting with Marianne and Julie, very useful meeting, and actually. It's always a bit of a dilemma because the report's 12 months ago and they've done an awful lot of work since the reports. But so we've got to almost reflect that the work that they have done and the continued support of Marianne. I think she's an excellent chair. Really nice to have meetings with her on a one-to-one basis or however many there were of us on the meeting. So welcome. So we have had the report, Marianne, but would you like to add anything to the report?
Yeah, well, you'll probably all be relieved that I haven't got a PowerPoint presentation and helpfully, at the beginning of the report, I've put a bit of a foreword really to draw people's attention to the highlights and the areas of challenge. Julia will probably be chuckling at the next bit because I just wanted to capture my thoughts really in 3 particular areas. What's working well, what we're worried about, and what needs to happen. So I'll start with what's working well, and this is reflected very much in my foreword, but I just thought it would be helpful. So I think we have a really strong and mature partnership in Calderdale, and I think that's really positive. We've got very engaged and proactive partners, so to be fair, it's a good place to be a chair. You'll see from the report that our care homes and our nursing homes in the main are good. And you'll also see that the vast majority of those people receiving safeguarding services feel safer. So I think, that's a really good foundation. You'll see that the cultural change from the burnt bridges or the building bridges, as we've started to say, report continues to drive that trauma-informed practice, some really innovative practices, service improvements, and particularly the development of that making every adult matter approach, the multidisciplinary team meetings to deal with those really complex needs. So there's some really fantastic work, which is quite unique in some ways to Calderdale. So that's really good. We've launched the new TRIEX procedures, so that makes us in line with a number of other local authorities, so easier for those staff that work across more than one local authority, but also really accessible, so you can pick them up on any kind of handheld device. So workers that are out in the field that need to just check on something can do so really easily. So that's real positive. And the development of that communication and engagement network, I think, is something that's working really well for us. So moving on to kind of what we're worried about. And I think, you know, the impact of COVID, the impact of austerity, those increasing referrals, a high percentage of which don't meet the criteria. So what do we do with those that don't meet the criteria but still need some help? The complexity and acuity of cases, I think, are a concern for us. The financial viability of care homes, recruitment and retention of staff and the resilience of staff across the health and care sector is a concern. And I suppose capacity of staff to continue to meet this demand, capacity in the system, and the consistency. So making sure that every frontline worker is providing the same response. We've got an increasing diversity within our communities. So, you know, how can we rise to that challenge? I think that's something that we need to really focus on. And again, looking at those inequalities, you know, we know that the highest number of referrals come from the areas where there are the highest indices of multiple deprivation. So how can we really get beneath that data and try and drive out inequality in the system? And I suppose the challenge as we move into the right care, right person initiative driven by the police. So those are the sort of things that we're worried about, I suppose. So what needs to happen as we move forward? Well, an awful lot of work has already gone into looking at those increasing referrals, and we talked about developing a thresholds document, so consulting with people in frontline roles and managerial roles to actually identify what a safeguarding concern is. And an awful lot of work has already gone in to do that, which will help us once that's launched to really make sure that we're receiving appropriate referrals and the data quality is improved, so we can actually do some work when that isn't happening to try and address that and make sure people do get the help that they need. Development of the multi-agency safeguarding hub, which comes on the back of the huge amount of innovation work that's taking place in adult social care, which will really strengthen our information sharing and our multi-agency working. So that's a real priority for us. Cementing the practice on the back of burnt bridges, making sure that these innovations become business as usual for us in Calderdale. Looking at things like those pathways, so identifying where perhaps there aren't services for people and developing services to plug those gaps. We've already held a development day with Children's Safeguarding Partnership to focus on transitions. So some more work to strengthen the work around those people making that transition from childhood to adulthood. And I suppose the way that we respond as a partnership towards the Right Care, Right Person initiative, so developing our policies and identifying and bridging gaps in service that will come when the police have to step back from the work which they've been doing, which they have no power to do, but have felt obliged to do. So I suppose those are the things that really, really need to happen. So a challenging year, Howard, but I've been really impressed by how partners have really risen to that challenge and impressed by the passion and the hard work of our frontline staff, which never ceases to amaze me, really. So happy to answer any questions.
Thank you for that, Marianne. A very comprehensive introduction there. That's really helpful for members to understand and set the scene. I know in our meeting we suggested that actually with the annual report moving forward, that actually we have a bit at the bottom of the report saying actually what you've been working on for the last 6 months. You know, so actually. I think it's really useful for members. And just to let you know as well, the Scrutiny Board is actually doing a review of care homes, so we may call upon your assistance to actually. So I think Mike Lodge will note that comment as well. Right, everyone's put their hands up, and I didn't see which order, so my apologies. I'm going to do Councillor Durrance first.
Thank you, Chair. I've got a couple of questions, if it's okay.
So it's absolutely.
I'm probably going to focus on a couple of areas. I'm doing some of the detailed review work that we're doing at the moment, and actually what Marian's kind of addressed is key within the services that we spoke to within some of the knife crime review in particular, that idea of working forward thinking and where you want to be is very much clear throughout the thread. But some of what came out of that, and I think I'm hoping I'm okay to address it, is the challenges of trauma-informed practice and delivery around the culture of some of the staff within services, and the barriers about people who are responding to really serious incidents or ongoing challenges, the strain that they're under, and their own trauma around that. And I just wondered if that was something that you've come across, that shift in, or needing to shift people's culture, particularly within services who were having to understand trauma differently and the impact of what that is. So shall I leave that one there and then come back to my second question?
That's probably quite good. Julie, you've got your hand up, so I'm presuming you're going to answer that one.
Yes, that's okay, Marianne. Yeah, so I've literally just come off the back of Debs Harkins leading the meeting on trauma-informed practice from West Yorkshire. So the West Yorkshire Health Partnership were involved, but for Calderdale. We've got a maturity matrix that we're going to complete. Simplified, what that means is rating ourselves of different levels of whether we're trauma-informed, right the way through to trauma-informed practice. And I'd say in Calderdale, we're ahead in terms of people who live who have multiple complex needs, who live street-based lives. I'd say we're streets ahead of our neighbours and actually up and down the country. And then on other things, I think we need to catch up. Certain things around, transitions from childhood to adulthood, and potentially, even more within the young person's field. So we're going to be doing a lot of work. So there's a big partnership of us led by Debs Harkins to do exactly that, Councillor Durrance. And it's not just about awareness or training, it's about actually what you're doing at the, to change people's lives and, outcomes for those people.
Thanks, Julie. Yeah, if you want to come back, Councillor Durrance, with your next question.
Yeah, so next part is particularly around the complex side of our most vulnerable residents. I was really grateful that I could go and visit. I hope I've got this right. The Unity Project and the work that they're doing after the Burnt Bridges work is just really inspiring, really, in building kind of confidence within the actual residents to want more and know that they deserve more. And I know that the community has really grown from that. What kind of did come on the back of my thought processes around that community is now really building strength in keeping each other safe, calling out inappropriate challenges and risks that they are under from outside entities, outside of their own community. And that's not necessarily kind of being able to be shown outside of that community. So what are we doing, or how are we addressing the fact that people who, and I understand that the risks that it brings when you have a larger community who have those challenges around them, complex needs, but whilst they're all together and the gates and things have really added that value of safety, what are we doing to ensure people who don't live within that kind of environment and community are remaining safe from some of the outside entity and risks?
Thank you.
Do you want to go first, Marianne, or do you want me to?
Yeah, no, I can do. I think you're talking about Union Street. Yes, and that's that's private accommodation, that's private rented accommodation that's been provided, but an awful lot of support services have been put into that location to try and help those people. But in addition to that, we have Craven Mount, which provides self-contained accommodation for people with complex needs. We've got some move-on accommodation. And I suppose from a safeguarding point of view, we try and make safeguarding personal. So the package that is put around an individual is suited to their individual needs. And certainly one of the things we learned from Burnt Bridges was the need to take services to people rather than expecting people with complex needs, perhaps without the resources, personal, technological or whatever, to actually get to that doctor's appointment, that hospital appointment, to meet with somebody somewhere else. So an awful lot of work has gone into actually providing services to people where they are, be that in their own accommodation, be that in some semi-supported accommodation, up at the gathering place, or wherever really. So that's been a real culture change where people have really started to understand that people have had previous traumas that lead them to where they are in life, and actually they need extra help and support to get the help and support that they need. So yeah, Union Street is really unique, but there is the similar sorts of support provided to people in different settings across Calderdale.
I think Marianne hit the nail on the head as well with the making safeguarding personal, and those multidisciplinary team meetings are multi-agency partnerships around a particular person and their individual needs and wherever they're based and whatever those needs might be. So definitely individualised, but also organisationally. So you'll see in our report that about the eviction rate, that actually they see evictions as a failure. So that's across the board, no matter where you are, to keep people safe. So I think both individually and organisationally, that trauma-informed and a much better approach in Calderdale.
Thank you. Councillor, to answer your
one more question.
You can indeed.
How are we ensuring that the mental health services are learning around dual diagnosis needs? Because often that can create a barrier and either side of that barrier, as in, without addressing one, you're not going to address the other. So what are we doing to ensure that people who might have a dual diagnosis are receiving the same level of care that those who don't have that?
Just before they come in, actually, because I serve on the South West Yorkshire Partnership Board. And it's something, and there was something that we have actually raised with them to investigate it further, actually, because there's an awful lot of work to do from that angle. So wearing yet another hat, that's another one. But over to you, Marianne and Julia, on that one, if you want to equally add anything to that.
Yeah, I think dual diagnosis is an issue, not just locally, but nationally. It was a key finding that came out of the Burnt Bridges report. So I think on an individual basis, things like the MDT meetings, those multidisciplinary team meetings around those individuals with complex needs, are tackling that issue, challenging services around those. Oh, we can't give them we can't address their we can't address the mental health issues until they're off their alcohol or they're off their drugs or whatever. So we are challenging that on an individual basis. But yeah, it was on my list of what needs to happen. I think we again need to systemize that. So make sure that that's happening as a matter of routine rather than it being case by case basis. I suppose it's about making sure that that is routinely happening and changing policies as well. So yeah, there's some really good work ongoing, but more to do, Councillor.
Thank you, Marianne.
I think it's safe to say that it's not easy. It's not easy. There's not a lot of places that have got this right. And actually, as a partnership, as a board, we've held on to the action plan for Burnt Bridges for so long, and actually we've got to a certain point and handed over to the MEAM group, the Making Every Adult Matter group, those things that are still left to be done, those really wicked issues, and that is the main one. Actually, it's probably one of the only ones left that still needs tackling.
Okay, thank you, Julia. Councillor Pritchard.
Thank you, Chair. Just a quick comment. I love the quote, "Change is the only constant," Marianne. I'm sure that's going to appear in a speech somewhere.
You're very welcome.
Thank you. You said in general care homes were relatively good. and yet there was an increase of 1,000 safeguarding concerns, the highest rate recorded so far. And 50% of these concerns were from care homes or care homes with nursing. I'm just a little bit troubled by that quote and the figures.
Yeah,
explain.
Yeah, no. I mean, I think the increase in referrals, and we've always had really high levels of referrals in Calderdale. I'd probably rather somebody be referred inappropriately than somebody who needs that service not be referred. So I'll say that to start off with. But what we have to be careful is that we're not overloading the system and the social workers can't see the wood for the trees. So that we need to get that right. We receive an awful lot of inappropriate referrals from care homes that are actually quality of service issues rather than safeguarding concerns. So I suppose a lot of the work that we've been focusing on is making sure that actually those workers within the care homes and within the nursing homes understand the difference between the two and feel empowered to just make appropriate referrals, but also empowered to raise quality of service concerns. I think because of the inspection framework and CQC, a lot of people working in the care sector are frightened to death of not raising a concern and then being criticised by CQC. So when we've developed our thresholds document with those frontline workers, we have also consulted with the CQC to give them that assurance that you know, if they stick to this guidance, they're actually doing the right thing and they are not going to be criticised. But on the other hand, we've had to make sure that those quality of concerns are being picked up, because clearly if medications are being missed or if lots of patients are tripping and falling, then actually that might mean that a setting is not safe and it is an overarching safeguarding concern. So we've developed the safeguarding thresholds. We've also developed an organisational safeguarding policy as well to manage to bring those two things together, if that makes sense. Yeah. So yes, you know, the data tells us that our care homes are generally good, a few outstanding, which is nice to see, but equally those inappropriate referrals are still coming into the system, and that's what we need to address, but in a safe way.
Okay, thank you.
Thank you indeed. Councillor Kingston.
Thank you very much. I'm reading the Mr. C review and the recommendations coming from that, and particularly this statement at the end of the learning from the review that many of the issues in this review were similar to previous reviews, and that transforming learning into improved practice must remain a priority. It's just reading it, and it's just like a bit of a horror story, really, isn't it? And thinking we really have failed that man. We've really failed him. And one of the key problems coming through, I see, and it's come through in several of them, was the lack of coordinated multi-agency working. So there's that lack of coordinated multi-agency working, and there's that not transforming learning into improved practice, and those seem to be themes. And you know what, I just wonder, are we doing enough about this? What are we doing about this? Is what we're doing about this at any point being effective? Where are we seeing it having an actual positive impact?
Okay, there's a lot of questions in there, but I'll do my best, Councillor. Yeah, I mean, Mr. C is a really sad case. Ironically, it wasn't the death that caused the fire that caused his death, but nonetheless, I think it raises some really important issues around trauma, around self-neglect, and around those people that need safeguarding support that are living in the community, in their own homes. And I suppose that's one of the concerns for the board, was that we have this disparity in the number of referrals that are coming from care homes that are probably not serious, are really not safeguarding concerns, but the lack of referrals that we're getting from the community, when we know more and more people are living in their own homes. And actually our strategy is to support people to live in their own homes for as long as possible, rather than institutionalising them. So it raised some really important issues for a Safeguarding Adults Board, and that's one of the reasons why we decided to do this review. That sharing information and that coordinated response across a number of agencies is really important, and it was sadly lacking in this particular case. I think we have, self-neglect has become a real theme for us, and I think we've developed training around it, and I think we've improved knowledge around it. We've provided policy and guidance for people and toolkits to recognise and respond more effectively to self-neglect. And as we've already talked about, we now have those multidisciplinary team meetings to discuss complex cases. So, I am as confident as I can be that if another Mr. C presented himself now, we would pick that up through our hoarding panel, which is multi-agency, and that we would refer that into a multidisciplinary team meeting to make sure that we put that personalised plan around Mr. C to try and prevent his death. So, but some really important learning. And I think that multi-agency approach is happening for those complex cases, but actually when we have that fully working multi-agency safeguarding hub within adult social care under the transformation project, we'll be doing that multi-agency information sharing and decision making with all of our cases, which is where I think we'll really make a massive difference in Calderdale. But a really sad case, but an awful lot of good work on the back of Mr. C.
Thank you, Marianne. Welcome, Anne Flanagan, back to the authority. I don't know if you'd just like to say a few words about your role in Calderdale before you equally come on the back of the question as well.
Thank you, Councillor Blackborough. So I just wanted to come in. So I'm here now as the interim assistant director and the transformation lead. But I just wanted to Marianne, thank you. You've done a really fantastic job of explaining all of the strategic thinking and the background and all of those things. So really, really helpful. I wanted to just say something specific about how we're reorganising ourselves on the back of the learning from the SARS and all of the burnt bridges and all of those things. But we are putting in place a specific dedicated safeguarding team that will all be in place by early new year. It will make a huge difference to, I think, capturing all of the themes, the learning, the organisation around the multi-agency working. It will give a platform which will mean that we can develop the MASH, the multi-agency safeguarding hub, which we all know that we want and need. And I did want to just say, having not been here for a year, I was here for a short time a year ago, the work that's been done in the last year has been really extraordinary, I think. And the way that the adult services and wellbeing and public health have taken some incredibly brave decisions about how to work with people who live on the margins in all the ways that we've just heard described, I think is just hugely impressive. And I did want to say that I'm slightly an external person, having only been here for a short time. It is really, really impressive the way that people have stood up to the terrible things that happened for the people who were reported on in burnt bridges, and the bravery and the decision making that's taken place is really just extraordinary. And I hope that people can see that we are doing quite magnificent things to support people who have been traumatized by our system, are living very complex lives, but we really are doing some quite spectacular things. And I think, Marianne, you've done a really excellent job of describing all of that. Just wanted to just put the detail on our specific teams that are going to, we've moved staff around, we're changing our pathways, we're sorting out our referral arrangements so that hopefully we're not going to see people fall through the cracks in the future. And I do take my hat off to all of you for all of the work that you've done over the last, however long to get these things in place. Yeah, thank you.
Thank you, Anne. Thank you once again. Well, that was the warm-up part. Councillor Hutchinson, is now over to you.
Oh, sorry to disappoint, but I am really heartened that the focus has been maintained on seeing through the Burnt Bridges, the recommendations from the Burnt Bridges report in most circumstances, because we know that if you take that focus off, then things will tend to revert to the previous state, particularly as you get changes of staff, if it's not consistently embedded in the ways of working. So please, I hope with it moving to the making every adult matter team, that focus isn't lost. And it's good to see that some of the learning is also spreading out more widely into how we support all those people who aren't absolutely typical, because there's an awful lot of them in a lot of different places. What I did want to ask, though, there's a couple of things, if I may, Chair. One is it is concerning about the 25% increase in referrals to safeguarding services, particularly from care homes and care homes with nursing. And I'm not sure that I fully understand from this report exactly what has been driving this, given that there's also an increase in the ones that progress to stage that meet the Section 42 definitions. I was wondering whether that says more about how easy, the relative ease with which it is to raise a safeguarding concern for staff rather than to raise a quality of service concern. And have we got the pathways for staff to raise, or staff or next of kin or residents themselves, to raise quality of service concerns? Are those clear and accessible for people to actually do?
Thank you, Councillor Hutchinson. So Kath, I think you wanted to come in on something, if that's okay.
Sorry, I couldn't get off mute there. Yeah, it wasn't on that point. It wasn't on Councillor Hutchinson's point, but it was just on the to kind of support what Anne had said, and also Marianne, about, I think, the strength of our system and the strength of relationships as well. So, I know I've been impressed as well by the multidisciplinary, multi-agency approach and the way that that's developed over the last 12 months. But I think it was Councillor Kingston in her questions around what kind of thing, how are we going to make this, how is this going to improve in the future? And I think there are various ways. So I think in terms of the wider transformation of work, which I know we're not going to speak about tonight, but for example, the development of neighbourhood teams and the role that we will play as adult services in that. So we do work in a very joined up way now, and we're working closely in partnership with our colleagues in the health and the voluntary sector as well. But that will kind of bring those relationships closer under a shared culture of strengths-based, trauma-informed culture. So that's why we're really pushing that change of culture and why we want to do that transformation across the board in an integrated way. So we really share that, that kind of way forward and that culture. And again, that greater focus
on people who, I think Marianne said, or people who are living on the margins. So we're not applying exclusion criteria to people, but we're including people and looking at alternative solutions and working alongside them as citizens. So I just wanted to make that point.
Super, thank you very much, Kath. And Julie, if you'd like to come in on the question in hand, please.
Yeah, so for Councillor Hutchinson's question about the numbers specifically first, I think some of it actually is has been classed as a good news story. So for a start, the number of concerns are people living in their own homes in the community. Those are the things that have actually raised, which we would class as success. So whereas previously referrers in the community were less likely to refer because it was very care home based, that's where the safeguarding element was, and those were where the referrals were from. We've encouraged over the years actually referrals to come from the community about the people with multiple complex needs who are living street-based lives, and more has come from there and from people in their own homes. Which is a good news story. Historically, the reason why we have so many referrals in is from a serious case review about 10 years ago about a care home, and at that point everybody was told at that point, every care home provider, to refer absolutely everything in, and that carried on, and that had remained to be the message. The year we're talking about is 2022-23, which is still picking up after COVID too, where more people are being seen by more and more professionals, which accounts for some of those increases in the numbers. I just want to say as well, we are out of kilter with statistical neighbours, and nationally and regionally. With regards to parity, if you go to a children's numbers of referrals and abuse and neglect, it's pretty standard about how people count things, how they're measured, how they're compared with each other. You're counting apples and apples. In the adults world, it's recognised nationally that that's not the case, that actually different local authorities count in different ways, and so it's really difficult to streamline. When we've gone to national events, they've hailed Calderdale as being a real success story because of the amount of concerns, and because they're, what they're actually counting can be seen in the whole system, and actually is a brilliant method of intelligence. What we're moving to now is this new thresholds where everybody understands then what a safeguarding concern is. And what we're hoping that will do is bring the numbers down so that it's less like a needle in a haystack. So actually that quality issues are managed by quality teams, by their own in-house, by CQC, by contracts commissioners, and actually that safeguarding concerns can be responded to in a multi-agency way that's thought through. And as in the new transformation with the multi-agency safeguarding hub, and there'll be less Mr. C's in future. So that's the shift. And that's I just wanted to go back to the point you made about the safeguarding adult reviews, which is that's the reason really why there has been this transformation project, because of the things that these reviews that you've seen published in the report has found, and so that's been the culmination of where we are today with the changes.
Thank you, Julie. Before I bring you back in, Councillor Hutchinson, I'd like to bring in Anne, please.
Thank you, Howard. So just exactly that. So we are a huge outlier in the numbers of concerns that come to us. We are, exactly as Julia's just described, it's a culture that's developed because of a horrible situation 10 years ago. What I did want to say though is that 98% of the people who we see through the process of Section 42, so from concern to inquiries, etc., they have had their risks reduced or removed. This is a hugely positive story that we kind of slightly get lost in the number of concerns that get raised to us. The reality is that when we see people through the safeguarding process, the very vast majority of people have their risks reduced or removed entirely. That is a really unusual situation. That is not the case in every authority. Exactly as Julia's described, the kind of needle in the haystack story, we get far too many concerns raised to us, which should be dealt with through other arrangements like quality concerns. when we get our story straight and get our organisation right and put those things into the place that they need to be, which is around quality, not safeguarding, we'll see that number go up even further. And it just is a very clear indication that we do a very, very, very good job here in Calderdale on managing those risks and reducing those risks or removing those risks.
Thank you, Anne. Councillor Hutchinson.
I'm certainly not advocating an ostrich response to issues that arise, and to some extent, the definition of what's a safeguarding issue and what's a quality issue, they both need to be addressed and they both need to be visible. So I'm still not clear whether the mechanisms for concerned people to raise service quality issues are clear and easy to follow without retribution to the person who's making raising those concerns, and where an overview of those quality measures actually sits, so that if the overall quality of services being provided, either through domiciliary, but in a large number of these cases through residential care and nursing homes, goes, that whether those will disappear from view.
Can I help, Councillor Bagrid? So we have got a very clear understanding now of which pathway safeguarding needs to go down, which pathway the quality concerns need to go down. We're not at all going to lose sight of those quality concerns. We're just going to get them dealt with in the right place. And to be really frank, it's so much better to have the pathway clear around what is quality and what is safeguarding, because we get lost, we get very confused about when we have them all in one place and the numbers are very high. So we're very clear which route this needs to go down, which route this needs to go down. We're going to publish the thresholds, the pathways. It will be clear to people. It will take a while to make the changes. So we'll take all the concerns in the same way that we ordinarily do. No change to how providers or members of the public need to report those concerns. We will filter them into the proper place. So we will be very clear about, this is a quality issue. These are the right people to address the quality issues, which is our quality assurance team. This is a safeguarding issue. These are the right people to address that. So you need your contract commissioners to deal with the quality issues, and you need just social workers to deal with the safeguarding issues. So I feel very confident, having been here for quite a short time, that we have got it. We have got the planning right. We are going to implement it from the beginning of January. So we've done the recruitment, we've got the people in place. I'm very confident that we will have those arrangements in the right way from the early new year.
Thank you, Anne, for that explanation.
If I may, on another point, Councillor Chair, I share Councillor Durrance's dismay that we still haven't got dual diagnosis services sorted. We've been raising this in this board for 5 years, to the best of my knowledge, and being told, oh, it's a difficult issue. Well, at some point it must, we must come to find some way of actually addressing it through the contracting framework. We can't be here in another 5 years and there's still being told, oh, it's too difficult to sort. But the other issue that we've been on about for a long time is transitional helping people through the transition between this very artificial division between children and young people and adolescent services and adult services. I'm pleased to see that Calderdale and Huddersfield Foundation Trust has appointed a transition clinical nurse specialist. but our concerns have largely been around the mental health and disability disjunct, the break between services and the enormous chasms that people can fall through when they reach that age of transition. And I haven't seen anything in the report to suggest that that has been taken on board by those commissioning mental health services. Can you tell me what is going on there?
For mental health services, I think you'd probably have to ask the mental health agency. I can tell you more broader on transition that we've got really good examples of transitional pathways in certain elements and for certain cohorts of people. Fantastic, transition from really good planning, aspirational, outcome focused for transition. And there are gaps. There are gaps because of statutory obligations, of things cutting off at age 18, of funding, many different issues, of which now, following our joint development day from children and adults, we're exactly looking at what those gaps are, where there may be children who are not being supported, where there's not that aspiration, where adults are more at risk, where there's a cliff edge at age 18 than there is for some young people. And we're really looking at actually what we can do in Calderdale with the resource and staff and time and everything else that we've got. We're looking at best practice in other areas and how we can bridge that gap, basically.
But I would stress that this has been something that has been raised for many years. And if we're still looking at it, that really doesn't seem adequate to me.
Thank you, Councillor Hutchinson. I think that's been taken on board. Councillor Durand, so I appreciate your patience there.
No worries. I just wanted to come back to the safeguarding of people within their own homes. And I think a couple of you have touched on it, but I'm just wondering around the disparity in people in different areas, not necessarily feeling, or the level, I guess, at what people assume is risk or not risk, depending on different challenges. For instance, if somebody's particularly isolated, how are we ensuring that the nosy neighbour is something that we should be considering in order for people not to be left interminable amounts of time versus somebody who might have addiction issues, and knowing, as I think Julia referenced, the difference in people addressing children neglect is much quicker than people who are adults who are potentially under levels of challenge or neglect. So I just wondered what we're doing to address that message in communities, to ensure communities are confident in raising concerns, they can access systems, understand what they should be addressing in the same way, I guess, without over-egging the pudding that care homes did, but making sure that all of our probably more vulnerable residents are given the same level of response.
Thank you, Councillor Durand.
Shall I go first, Marianne? But for me, the way that we're structured as a board, there is an overarching board that's made up of about 30 organisations from voluntary, community sector, as well as statutory services. And then there's a plethora of subgroups underneath that and work streams at which more voluntary sector services sit, providers of services. The constant messages about what is safeguarding, the different types of the new things that are coming up, horizon scannings, what we might have to look out for, particular things with cost of living crisis and whatever it may be, is, I mean, we attempt to infiltrate everything with those messages to make sure people are aware of what their staff, their volunteers, the people in communities need to be aware of, how they can refer in, the free training that's available through the board and the partnership, which is extensive and which I think last year, thousands of people took up. So that's one way. I don't know whether Councillor Durand, whether that answers a little bit, but that's one way we're trying to make sure that everybody is aware of what safeguarding is, what they do about it, how to identify, how to work with other people. On top of that, we have a quite robust escalation policy now. One was raised to me this week, which is brilliant, where those services and agencies on the periphery who may not get the response that they want or understand can question that, can challenge it, and that would get raised all the way up to the board if necessary. It never does do. It kind of stops below Kath somewhere, usually. But an escalation process to say, I'm not happy with this, you know, there's somebody here who I'm concerned about. So those few things are what we try and do to address that, really, Councillor Duras. There will always be an unknown. I think it's important to say. And I think there will always be people out there who maybe have been abused and neglected that no services know about. And, you know, I think bringing communities on board is really important, and that's a job for us all.
I think, to be fair, Julia, the idea that you know there's always going to be an unknown addressed as safeguarding again, because it's important, isn't it, that you don't kind of think you've covered all bases. So that's really useful. Thank you, Chair.
Thank you. Councillor Barnes.
Thank you, Chair. Just a quickie. What involvement are you going to have in the development of the new software system?
Personally, so we've given learning.
Yes, of course, Julia. Of course, yeah. Personally.
We've given learning from the reviews to the software. The very fact that the same system will be used for children and adults is actually just very, very pleasing to me. The fact that we had two systems before that didn't talk to each other is probably the most important thing to me, working across both children and adult services. I hope, you know, I'll be involved in that as it develops, but that, to me, that's the most important thing, Mr. Barnes.
Yeah.
So, Jack, let's come back, because obviously with that system and a lot of the work you do is based upon the data coming through. So obviously that's just you know, I suppose we just want to make sure that it's. I'm not saying it's fit for purpose. I don't mean that in a certain way, but obviously that system is designed is going to allow these meetings to take place in the future, hopefully maybe sooner than December for the report for March. Yeah. We will get onto my point that I've raised before, but I know that's nothing to do with you. But that's really the sort of, you know, I think if we are going to get a new system, then we need as many stakeholders involved in that as possible. That's where I'm coming from. But I think the fact that Marianne and Kath have got their hands up would probably imply the answer is going to be yes, but there we go.
Super, thank you. I'll take Marianne, then I'll take Kath.
Yeah, interestingly, we had our business group meeting this week, and we talked about the new system. And Luke Turnbull, who was the chair of our data, of our performance and quality assurance subgroup, volunteered on behalf of the board really to get involved with that particular development of that system. And certainly we had some discussions about the changes in the data that we would expect to see following the transformational work taking place. And how we could use that data then to do the quality assurance work that we would need to do as a board. So yeah, the offer is definitely there. We are discussing it, and obviously we need to know what the outcomes are. So yeah, the ability of that data to help us to be more outcome focused is really welcome. But yeah, certainly as a board, we have been asked to get involved in developing that system, but then obviously to do some of the testing of that system when we get closer to the product being launched, which will probably be a while from previous experience. But yeah, definitely we will be involved.
Thank you, Marianne. Kath?
What Marianne said, really, Councillor. But also, I suppose, just to stress, there's an enormous amount of work going on around the development of the system, and you know, making sure that we include all stakeholders, but and also the social workers on the ground and other social, you know, safeguarding practitioners, to make sure that we build it properly and we've got the right kind of data sources, etc. So there's an awful lot of preparation and work going on in that area.
Thank you for that. And whilst I've been talking, Julie's actually done all the programming and is all ready to run for tomorrow. Perfect.
And I would say, actually, just to note, up to this point, the board has been instrumental in the development of the current system, of the CIS system. So actually, I don't know how many of you have been here that long, but years ago, in our annual report, we've referred to the fact that we couldn't get any MSP data and making safeguarding personal data, and the pressure that the board put on the local authority at that point made the changes to the CIS programme, and we can now report on that and see that if we're making safeguarding personal. And there's always more to go. So I just want to say that the board has been instrumental in so far in actually what the development of the software systems report and can tell us. Just aside from that, because it's not all about systems, we as the board, we're probably the ones that are trying to lead. So we've just relaunched. So since this annual report's been written, and from now and from those safeguarding adult reviews, we've rewritten the self-neglect toolkit, and that's now gone out to practitioners. The next thing will be to look at multi-agency risk assessments. So based on what we're doing at MDT, but written down in paper format. So, you know, we're still developing. And so it's not just systems, it's how people can work together more effectively. That needs to be linked to the systems.
Super. I like the idea. It's spot on. Councillor Pritchard.
Sorry, my fingers are too big. I keep going on mute. I've got a question about deprivation of liberty. There's an increasing number of deprivation of liberty applications during 2022-23, and many people awaiting completion of their applications. And with the indefinite postponement of the liberty protection safeguards, what type of mitigations could be considered to safeguard the risk of unlawful deprivation of liberty occurring, and will they be effective?
I can't somehow work out how to put my hand up for some reason at the moment, but can I come in?
Yeah, come in, please.
I've moved rooms and now I've lost control of everything. It's a really, really good question. It's an important question to ask. We're no different to any other local authority in the country, as I'm sure you know, in being well behind lots of delays. However, what we are doing is taking a risk-based approach to managing those delays and those waiting lists. I can't sit here and tell you that it's perfect. It isn't perfect anywhere. It's far from perfect. However, we have a very good system here of triaging and making sure that we're looking at the most risky people, the most risky situations. That's probably as much as reassurance that I can give you, that we are really taking care of who is at the most risk, seeing those people early, dealing with those people as quickly as we can. We can't genuinely say that we have got everything covered, because LPS, as you've said, is indefinitely delayed. We don't have enough resource to see everybody, but I am confident, and I think Kath, you probably, I'm sure you'd agree that we're confident that we're doing everything that we can to make sure that we're keeping the most vulnerable people as safe as we possibly can on those dolls lists.
Okay, a secondary question on the back of that.
Just before you do, let me just bring Marianne and Kath on those last points, if that's okay.
Okay.
So hold your thoughts for a few moments. So Marianne, please.
Yeah, I was just going to add to what Anne said. As a board, this is something that we are really keeping tabs on and having updates on dolls on a regular basis. So yeah, I know that they are being triaged. I also know that the ones that tend to be left on the list are people where the dolls has been in place for quite a period of time and it's a review rather than a new dolls application. And I also know that in comparison to other local authorities, we're really low. So yeah, it's not perfect, as Anne said, but it's as least risky as we can possibly manage it. And certainly we're in a much better position than a lot of other local authorities.
Thank you. And Kath, you're going to say all of the above.
Yeah, again, what Marianne said.
Yeah, exactly.
Yeah, have you noticed that Kath is slow getting the hand up so Marianne answers the questions? Look, just put it out there, folks.
Councillor Barnes, I know Marianne can get in there first and give her input.
The secondary question on the back of that was, will this affect the buying our care issues with deprivation of liberty? Perhaps Kath can answer that one.
Yeah. So yeah, thanks, Councillor Prashad. So what I was going to add actually was that greater assurance really that we've got within adult services and wellbeing within our directorate in terms of the work that we're doing. So we can give assurance to the Safeguarding Adults Board, but we're doing that deep dive work internally as well. So kind of really scrutinising and like Anne said, taking a risk-based approach to those waiting lists and all waiting lists. So where we've got waits for assessments, etc. We are taking that risk-based approach. In terms of buying our care and in making sure that we've got a cultural and religious and culturally competent lens on everything, I think the buying our care work and the work that we've been working on in the action plan is really supporting that practice. So we've recently, we're in development and we'll be able to share that with you very soon. A kind of flow chart around equality strands, and one of those being how we deal in a culturally competent way with people who are referred to our services. So kind of everybody, and prompts at certain points in those interventions.
Thank you.
Thank you very much. And once again, Marianne, thank you very much, and Julia, for presenting the report. You make the year go very quickly. That's the only problem. So it does fly by. We always welcome you on board. And you provide me with assurances that actually the Safeguarding Board is in extremely good hands under your reign. So thank you so much for the wonderful reports. Both myself and Councillor Barnes will have regular meetings with Julia and Marianne to highlight any issues. But thank you for presenting and answering the questions very comprehensively, so thank you for that. I'm sure you have better things to do, and we've got the work programme next, so thank you for your attendance, and we'll look forward to seeing you at some stage in the future. So thank you for that.
Thank you. Thanks, Al.
Yeah. Thank you.
Thanks, no worries. Mike, over to you for the work programme, please.
I just wanted to make 3 points, Chair, if that's okay. The informal meeting in January is it's Children and Young People Scrutiny Board had a very successful informal meeting, which was about explaining some of the sort of almost practice issues and how the practice works. And certainly some members here and Sean Cook, I know, was very keen that we replicated that for adults. So Libby and myself are working with Harriet Sykes and Joe Sutherland on the programme for that. So although it's an informal meeting, it's a really important meeting, and you'll be able to get some of the questions that you've been touching on this evening can really get to grips with some of the frontline managers and practitioners as well. So that's really important. Secondly, I think has been alluded to, Councillor Blackburn and Councillor Barnes are meeting with Kath and Anne next week. And very much that's about sort of, I think Anne in an email used the phrase joining the dots, making sure that we pick up on issues sort of transformation work that's developing in the directorate, some of the stuff that's coming out of the safeguarding report. Pick it up and see how you should take that forward as a board in your work programming, probably over the next year. Councillor Bradbury alluded to whether we might need another meeting. We might do. We've actually got a bit of a space in February that might be the place to fill that, but we need to make sure that the timing of your work programme is consistent with the timing of activity that's taking place in the directorate. So you're not going too early and we're not coming too late, if you see what I mean. So that's a really important discussion next week. And thirdly, just to remind you all about the budget seminar next Tuesday evening, which is a new way of addressing the scrutiny of budgets, and you'll be able to pick up issues about the medium-term financial plan, and Becky McIntyre and Councillor Dacre are going to talk about that. So I really would encourage all of you to come to that. That'll give you a real basis for addressing scrutiny of the Cabinet budget proposals when they're published in January. So that was it, Chair. Thank you.
Yeah,
oh,
thank
sorry.
you.
Just one thing, if I may. When Councillor Blackburn and Councillor Barnes met with Marianne Hewson the other day, she reminded us that her proper term of office has just about expired, but she's staying for another year, which I think you all should be really, really pleased about, because she's come and given us a great report this evening, and it's been it's really helpful having her in place.
Thank you, Matt. Unfortunately, I can't make this because I'm chairing the Brickhouse Town Deal Boards next Tuesday as another one of my roles. Councillor Hutchinson.
Can I just ask, on the session on the 21st of March, which is an update on the buying our care recommendations from this board, how is it going to be arranged that we get, I mean, this came to us through the concerns of service users or their families. I'd like to be sure that we get feedback from that kind of clientele to see whether their perception of progress matches the report that comes back from officers. So I just wondered how that might actually be incorporated in the meeting.
Yeah, thank you, Councillor Hutchinson. An important point, which I think equally going to pick up with Kath on next week, is my opinion. Is that right, Mike Lodge?
I was going to suggest that we should certainly cover that in our discussions next week. I mean, it's important to hear what people with lived experience have to say. I think it's also important that the board doesn't get into a place where individual service issues are attempted to be resolved. I think it needs to be at a more overall level, and I think there is a risk in that. But I think if Councillor Barnes and Councillor Blackburn can discuss that with Kath and Anne next week, we can find a way to make sure that update does take account of service users' perceptions. I've reminded myself that I've done a little bit of an audit of the progress against the recommendations from yourselves in March that I've sent to Kath, and I don't think Kath and I have picked up on yet, because I think Councillor Hutchinson probably was saying that the action plan doesn't necessarily explicitly look at the recommendations that the scrutiny board made. So my bit of work was an attempt to pull that together, and perhaps Kath and Anne and myself can touch on that and how we're going to pick up on that and plan that work for March again at the meeting next week on the 13th.
Thank you. Councillor Pritchard.
Yeah, I don't know whether this is really relevant, but it's something that's been bothering me. I listened to a local government webinar on the new CQC assessments, and I just wondered whether Calderdale had received a date for their assessments.
No, not yet. So you can see from Kath's face, Nan's face, it's like, not yet. Kath, would you like to go in?
But just to give you some reassurance, as I'm sure Kath will say, that we have been working very hard to get everything in place in case we get the call this time. I'm touching a lot of wood here, but we don't think we're going to get called in the next 20. But if we do, we're ready. We've got all our prep in place.
Okay, because I was quite surprised at the amount of work that they're looking at. on one of the pilots, it took 3 officers 2 weeks to pull together the pre-information before the visit. 10 inspectors turned up for the visit. They interviewed 164 members of staff, and frontline staff were separated from management during the interviews. I just wonder how all that will impact on the rest of the services for, you know.
I think we're heading on for another scrutiny debate if we're not careful. So I'm just going to bring Kath back in. It's not an item on the agenda, so I'm going to bring Kathleen just to, if that's okay, not wanting not to hear from you, but clearly this is about the work programme. So Kath, please.
Yeah, so just to give you a bit of reassurance at this stage, like Anne says, there's an enormous amount of work going on. We've got CQC project group, we've got assurance groups, assurance boards. We're working really closely with ADAS, which is the Association of Directors of Adult Services, locally and regionally and nationally as well. So, and we're taking up offers of support from partners in care and health, etc. So we're on to it, but it's going to be a big industry.
It's mammoth. Yeah,
it is.
Okay. Thank you.
Thank you, Kath, and thank you, Anne, and thank you, members. I think it's been an extremely useful debate tonight. Some important topics have been discussed, and it's been excellent. So thank you for all your contributions. It's always welcome, and always welcome, Kath and Anne, to our scrutiny meetings equally. It is that time of the year to wish you a happy Christmas. So happy Christmas and have fun. But and look forward to seeing you in the new year and working with you in the new year as well. So thank you very much for your support, and I will bid you good night. So thank you very much.
Good night. Happy Christmas.
Christmas.